Good afternoon, ladies and gentlemen, those who have joined us on our Facebook Live page, those who are watching us on SDPI's web TV live streaming, and those who are following us on other social media platforms. Today's session is basically the first of a series that SDPI has initiated, and the theme that we have chosen for this series is no one is safe until everyone is safe. Discussing new normal and discussing that how we can take care of collective security amid COVID and during COVID. Now, of course, when we look at exactly 1 year ago, 26th of Feb 2020, when we had two cases, the journey that Pakistan has covered in last 1 year, I think it's glass half full, if not glass completely full. We have achieved major breakthroughs, both in testing techniques, in testing numbers, in availability of ventilators, availability of protective personal protective equipments and other gears in different treatment regimes, and working on various vaccinations as well. When one looks at the social safety nets and social protection measures, again, we see that our performance was at par with our contemporary economies, if not better than them, but it was certainly not any lesser than them. So SAS program and taking care of 12 million families in the very first go, I think it was again a major breakthrough. But life in the new normal that we are going to discuss, where one has to maintain a balance between lockdown and livelihoods, where one has to maintain a balance between online education and the children's natural need for physical interaction, where they can intermingle with their peers and they can interact with their teachers, maintaining a balance between online health facilities and patients' need to visit clinics and surgery, and about the whole scope of technology, use of technology, 4G, 5G that is coming on our way, and also thinking of the digital inequality that prevails in Pakistan. So these are some of the things that would shape our new normal. And another aspect that would shape our new normal would be the vaccine, and whether we are going for private vaccine plus public vaccine, whether we are just focusing on public vaccine, what sort of inequality would be created due to different models of vaccination that we would follow. And another debate that is now becoming part of mainstream discourse, at least in some parts of the world, if not in Pakistan, and that is about a COVID passport, whether the Chinese vaccine that we will be getting, that would be a useful tool for us to travel to global north. As you know that those who were traveling in East Africa, they had to carry a yellow fever certificate, vaccination certificate with them. South Korea already declaring that they won't be accommodating a Chinese vaccine certificate if someone comes to South Korea with a Chinese vaccine. So all of these questions within these new normals, of course, we have public intellectuals like Mosharraf, Zaidi, and public policy analysts who would be able to give their point of view, how to go about. We have Mr. Hamza, Shafqaat, very proactive and very responsible Deputy Commissioner who has been trying to turn Islamabad into a model district. So what sort of complications and opportunities district administration can foresee within this new normal? And then finally, we have Dr. Nousheen Hamid, Parliamentary Secretary for Health, who perhaps can give us more about the way forward and some of the thinking in the powers of corridor and among decision makers, that how best to take avail on opportunities which would come forward in this new normal, and how to prepare for the challenges. Hamza sahab, agar main aapki taraf aau, again we are talking of the new life in new normal, and of course it would have added challenges district administration के लिए. अभी अगर हम 15 मार्च से देखें तो while you are one is trying to see comparatively more flexible Pakistan with the lesser COVID restrictions, we do say that all SOPs would be respected and would be implemented, but we see that in practice sometimes it becomes extremely difficult to follow those SOPs. So what sort of challenge and opportunities are you can you foresee after 15th of March, the life new COVID that we are going to live now?
Bismillah ar-Rahman ar-Rahim. Thank you so much to SDPI and to Madam Aisha and to Dr. Abid for inviting me for this very interesting session. And the question that is being asked is definitely very, very pertinent and important. Sir, what I feel right now is that the new normal, which we are considering as new normal, the general public as well as the government, they're still thinking of it as abnormal. So as long as we are not, as long as our public and government both don't accept this new normal as a normal and don't think of it as an abnormal, I think it will be very difficult for us to, move ahead. Anyways, the changing of perception of the public to create awareness, that is an issue and also a challenge, and we are working on it. But after 15th March, as we all know, that 2-3 things will become part of our daily routine. One will be the SOPs, and by SOPs I mean not shaking of hands, sanitizing our hands, wearing masks, and keeping social distancing. And similarly, from the government side, the inspections of all of these activities which will be going around, especially in schools and in marquees, in wedding halls, and now that the cinemas are being opened, so that will be another challenge to invade into the privacy of a cinema and then turn the lights on, and then check the SOPs whether people are wearing their mask or not. That is going to be a challenge, and that will, I think, bring a lot of bad name to the administration as well, because people still think that this is invasion of their privacy. Even in the businesses, in the last 1 year, I have faced a lot of resistance. चाहे उनको आप प्लास्टिक बैग से मना कर रहे हो, चाहे उनको मास्क पहनाने पे कहें, या उनको किसी भी बिजनेस प्रेमिसेस के बाहर ये स्टिकर ही पेस्ट करना हो कि जी विदाउट मास्क देयर विल बी नो सर्विस, उसकी तरफ उसकी की भी जो रेजिस्टेंस है फ्रॉम द ट्रेडर्स, वो बहुत ज्यादा थी. इवन इन स्मार्ट लॉकडाउन्स and even in putting people into quarantines, or putting an entire street as a quarantine, declaring it as a quarantine, and putting police over there to check the security. All of these were challenges, and I still think that despite this new normal, people are still resistant to this change, and they'll keep on resisting it for the next few months, hopefully. But what is the good thing that has come out of all of this was that we have uh, speedily and extremely with a fast speed, we have adopted information technology as a means of administration, as a means of communication. And even in government sector, all of the meetings are now being held on, preferably on Zoom. The daily meeting which is being held in the National Command and Operations Center, it is being attended by all 4 provinces as well as the ICT administration through Zoom, and all major decisions are being taken over there. And I think that has saved us a lot of cost, that has saved us from TADAs, and it has certainly improved the acceptability of information technology in general offices. Well, anyways, my last point, which I really want to highlight in this session, is that the biggest challenge still would not be resources. It will not be the adoption of IT. It will only be the changing of mindset of the public and the society. That is going to be a biggest challenge, and the role which the organizations which can play a role in it are the mosques, are the radio channels, are the social media, and the internet, as and this electronic media. As long as these 4 stakeholders are not genuinely convinced to convince the public to change their mindset, I think government alone or think tanks or intellectuals won't be able to help the people to adopt new technologies and new SOPs. Thank you very much, sir.
Thank you very much, Hamza sir, especially for highlighting the importance of collective action. Behavior change and change management, of course, it can't take place without collective action. Mosharraf is still starting out his internet connection. I just got his message on chat. So I will have to come to Dr. Nousheen Saba. Dr. Saba, in this round, we just wanted to get educated on Pakistan's plan for vaccination. We know that already Chinese vaccination has arrived, and we are already in negotiation with COVAX, and we are expecting some vaccine to come from COVAX as well, our share. And there are also some suggestions that perhaps some private importers, those will also be allowed to import private vaccine. I can see it as a good point as well as a negative point. The plus point is that it would import of private vaccine to me would somehow discourage the elites and influentials to actually bypass the queue and try to grab the vaccine which is imported for the frontline worker and for people 60 plus or 65 plus. But on the other hand, it may create some sort of anomaly and some sort of inequality, huge inequality, where those who can pay, they can pay and they can get vaccinated, but those who can't pay, they would have to keep on waiting. So maybe some sort of word of assurance from you. What is it that government is thinking on vaccination for this new normal to be a normal, as Shafqaat rightly mentioned, not an abnormal?
Thank you very much, Dr. Abid. I think it's a very good webinar which we are conducting today, and it's the need of the hour also. About the vaccination, obviously we all know that government is following almost the same priority population wise like the whole world is following. First, we need to understand what is our target population. Actually, we have about a population of about 200 million. So out of them, 100 million are below the age of 18. And presently, this vaccination is not recommended anywhere in the world for below the age of 18, except for the Pfizer vaccine, which can be given to 16 plus people. So that is just a bracket of 2 years. But in Pakistan, we are following that under 18 formula. And that leaves us with about 100 million population left to be vaccinated. And out of this 100 million people, if we are able to vaccinate 70 million, that is 70% of the population, we will be able to achieve the herd immunity, which is our target and which is essential to stop the spread of this virus pandemic. So initially, our out of those 70 million people, we have prioritized the populations, and as we all know that the frontline healthcare workers were the first priority, that we need to vaccinate those people who are dealing with the COVID or corona patients directly in the wards, in the hospitals, as technicians of, operating the ventilators, or the nurses, the paramedics, and the doctors. So those were our first priority population. And then, as you know, that 65 plus population was the second target. And now, because we have included the 60 plus population now also, and we are going in for registration. The basic reason why we have speeded up this population registration for 60 plus, and maybe in a few days you will see that we will include the 50% 50 plus population also in this category, is that we are not getting that response for people to come forward to get vaccinated. Although 4.5 lakh frontline healthcare workers got themselves registered, but we are seeing a element of hesitancy. It's actually not refusal, because they themselves got themselves registered voluntarily, but we can rather call it hesitancy. They are following the wait and see policy. Actually, they want to get the confidence, they want to see their fellow colleagues getting vaccinated and the response or the side effects they are facing. So I think now we are gradually overcoming that, and people are getting confidence in this vaccine, because initially when these frontline healthcare workers were being vaccinated, we hardly used to get 1,000, 1,500 people coming forward for vaccination. But now 2-3 days back, we touched even 15,000 target. So gradually this perception is improving, but still we have got about 9 million people above 65 and about 12 million people above 60. But as we can see that the registration is very slow. Very few people, a small percentage has come forward for this vaccination. So the government is planning to create awareness campaigns. And when we receive this AstraZeneca vaccine on 2nd of March, and then it will be sent to the provinces. And I think vaccination with this AstraZeneca will start by 5th of March when it reaches the provinces. So after that, I think we need to create more awareness, and the government is working on those strategies, the communication strategies and the awareness campaigns. And probably you will see in the coming days that some of the people of high profile, they will get vaccinated in front of the media. That is what we are planning, so that a clear-cut message goes across that this vaccine is safe and we need to use it for the betterment of our country, for the betterment of our population. We'll discuss more about this as we go on. I just want to touch the private sector. The private sector, actually, I think it will still take a long time in getting the vaccine provided, because at the present, the vaccine negotiations which are taking place between the countries, the bilateral negotiations, that is in huge amounts. And the private sector requires only small amounts of vaccine, which I think will not be very easily available to them for some time to come. And the only benefit of private sector is that the people who can afford, they will just leave the line and they can just go and get it vaccinated. Otherwise, the government has taken the responsibility, and our target is to get the vaccine for the target population, that is 70 million at least. What we have in plan, 30 million will be vaccinated by September, if everything goes according to the plans. And by end of 2021, we will achieve most of the target. So I think people will not need to go to these private sectors if the government plan is working. And already we will be getting more vaccines than those who are already registered. So hopefully only those people will go to private sector who are in a hurry or who can afford. Otherwise, it will not be a requirement for the ordinary population. Thank you.
Thank you, Dr. Sahab. And Mosharraf, I hope your internet issues, those are solved now. अभी जो हम बात कर रहे थे, you must have heard the viewpoints from both eminent speakers. New normal, whether to accept it as normal or abnormal, and what sort of abnormalities it can create, and on inequality that this new normal or normal can actually lead to. So I was interested in your comments as a public policy analyst.
So the first thing I would say, Dr. Saab, is that I think that the government, the principles around which the government has tried to design both the COVID-19 response overall and the vaccination plan, those principles are laudable, right? We have not had, we haven't had the kind of breakout that has taken place in other countries. We have seen efforts by the government to focus on the least privileged and the most vulnerable in the country. And the rollout of the vaccines has also prioritized and privileged, the frontline health workers and elderly citizens. So in terms of the principles of the design of the policy, it's been impressive. And I think it's been spot on. In terms of the execution of the policy design, there's a lot that, needs to be said. The first is that, overall, COVID-19 should have been a unique opportunity for massive reform. In fact, if I think back to your writing on this issue, Dr. Suleri, and I think back to, the conversations that many of us have been having since the very outset of the pandemic, the idea that this pandemic or this crisis could be used as an opportunity by the government of Pakistan, and particularly this government, to consolidate and forge a consensus around key areas of reform. So I think the degree to which the government has actually taken advantage of it from a reform perspective again, leaves a little bit or a lot to be desired. Firstly, this was a great opportunity to exercise Pakistani federalism at its best. And in some ways, that exercise has actually taken place. The NCOC is, in fact, a brilliant example of different arms of the executive branch, meaning the bureaucracy and the chief executives of the provinces, as well as the center and the military. All of the arms of the executive branch have come together, and they've produced what we know now as the NCOC, which has produced consensus-based decisions around the COVID-19 response, and now obviously the vaccination rollout. But whether or not this could have been designed in a way that had the sanction of the CCI, whether or not this could have been located at the Ministry of Interprovincial Coordination, those are questions that should be asked and should be explored. And it should be someone in government should actually ideally answer why those two vital constitutional or normative instruments were neglected. The second is, of course, something that Hamza, being kind of a superstar bureaucrat, is kind of the antithesis of, right? So if every DC in Pakistan was Hamza Shafqaat, I think we'd have grounds to be really excited. But as Hamza himself knows, and unfortunately we all know, high performers are at best 5% of the population of a cohort. If we give the Pakistani bureaucracy more credit, which I think we should, let's say 10% are like Hamza. That still leaves something like 135 DCs around the country that will not have the drive, the energy, the command of the issues, the competence, the support that they need from their seniors, the support staff that they need beneath them, all of those instruments that allow an officer to be successful. So the way in which most countries have designed their systems to make sure that they don't bank on a superstar officer, or they don't require a superstar officer in every instance, is to have effective local governments where a substantial portion of decision-making for what happens at the local level is vested in elected representatives. So it's not a contest between a state that's trying to enforce the writ that was decided on somewhere else and kind of, the people. But the people and the people that are deciding for the people are actually much closer together. So I think some questions about what lessons Pakistan might have learned on the local governance front. And then finally, and I think most importantly, I think the downside of a social media and TPR-driven public communication strategy. And again, Pakistan is not unique in this regard, whether it's Pakistan or it's any other country. We see a lot more antagonism in the public discourse. So we see that, a lot of politicians believe that they need to be on the attack in order for their followers to feel like they're being catered to. And in response, the attacked party also needs to attack. So when you have a public discourse that's designed around attack, then when there's a pandemic like we've had right now, the task of crisis communications becomes much harder. What should have happened is that the entire opposition should have, so as I was saying, what should have happened is that around vaccination issues, the entire opposition should have lined up with government. You should not just have had Faisal Sultan getting a shot, you should have also had Saida Afzal Tarar and maybe 2 or 3 other former ministers of health line up together to demonstrate that, when it comes to vaccinations, it doesn't matter what party you're from, it doesn't matter what province you're from, we're all together. Now, in order for that to take place, you need a leadership, whether it's in government or outside government, that is able to build consensus and bring people together. But unfortunately, in this kind of era of social media and TRP sort of dominance, it's very difficult to manage that. So I think on those 3 fronts, there are some lessons we've learned from a year of COVID-19. And I think the title of the session today is really apt. I think we are all in this together. Not so much in terms of let's get everyone vaccinated. Of course, we need to get everyone vaccinated, but more in terms of in order to get everyone vaccinated, we can't leave a DC to do all the work. the citizens of the area, the elected leadership of the area needs to help. And sometimes the elected leadership in an area will not be the same as the elected leadership in the provincial or the federal capital. And therefore, we need to be able to communicate and forge consensus across party lines. And finally, as I said earlier, I think that there's a great opportunity for us to renew and strengthen Pakistani federalism because of the excellence of execution that the NCOC represented. But in order for that to happen, we need to ask a few maybe uncomfortable questions about how we went about designing the NCOC. Thank you.
Thank you very much, Mosharraf, especially for highlighting the importance of building a certain degree of consensus among mainstream political forces to actually promote this vaccination. Hamza, Shafqaat, I'll come to you and have a couple of questions. First thing first, do we still emphasize on social distancing, or should the message be around physical distancing? Because I think what we require in a country with like Pakistan, where we have much higher population density than many of our global northern contemporaries, is to follow physical distancing. So maybe a message around physical distancing, but socially connectedness. Second thing, of course, within 1 year of excellent control and command in Islamabad, there will be certain lessons, something that worked for you, some certain things that didn't work. So is there any forum where other deputy commissioners, other administrators, they can actually share their ideas? So should we recommend through Dr. Nousheen, Hamid, and through media that government perhaps should convene a meeting of all the deputy commissioners whereby they can share what worked and what didn't work for them? And the last question that I would like to touch upon, when we talk of vaccination, it's not only about the access to vaccination, it's also about a stigma and taboo around vaccination. And we know that we do have ample doses of polio vaccine with us, but then there is a mindset against vaccine. And we have seen dozens of vaccinators getting martyred in an attempt to vaccinate their fellow citizens. So how to come around that mindset? I'll also take this question to Dr. Nousheen Saab as well, how to overcome this anti-vaccine mindset, not due to the fact that vaccine may not be safe, but we know that with the polio, it's certain other stigmas and taboos attached as well, that perhaps vaccinators, they are in guise trying to spy on certain sections of society. So as a district administrator, how do you reflect upon these couple of issues that I raised to you?
Sir, thank you very much. You have rightly pointed out, I'll try to answer the first question. That was that instead of focusing on social distancing, actually it should be physical distancing, and I completely agree with it. And I think in the last few months, the concept automatically changed that in order to deal with the stress and the trauma and the tension which was created because of COVID, it is necessary for all of us to stay connected, but physically stay distant. So I completely agree to it, and I think our slogan should be changed. And in fact, through this session, I have learned it, and I'll certainly propagate this, that we should be using the word physical distancing. I completely agree with it. Sir, as regard to the second point, that is there any forum through which all the deputy commissioners are connected? Sir, there is no a legal forum or no organization exists in the law where we can connect with each other. Rather, there is a forum in Punjab where all of the deputy commissioners are called in the chief secretary's office or the chief minister's office. But because the DC of Islamabad is not part of Punjab or KP, so we are never called into those meetings. We tried to develop such a system where we could stay connected on the dengue platforms, but even that couldn't work because sometimes the provincial government is from some other party, and sometimes the government in the federal is from some other party, so that system could not evolve. So I personally think that that is an excellent suggestion, that all the deputy commissioners of Islamabad, or at least the commissioners, all the deputy commissioners of Pakistan or the commissioners of Islamabad, should have some kind of a legal forum there where they could meet after maybe 2 months, 3 months, and they could share their ideas, and some sort of communication exchange should take place, and we could learn from each other. Personally, I think that I could share a lot of information regarding COVID responses and implementation of COVID in Islamabad. So I completely agree, and sir, you have rightly asked the honorable parliamentarian to maybe respond to that as well. Third,
pros and cons of vaccination in people's mind.
अच्छा सर, थर्ड में आपको मैं डॉक्टर नौशीन साहब ने सर पहले भी ऑनरेबल उन्होंने पार्लियामेंटेरियन ने पहले भी बताया कि रेजिस्टेंस नहीं है, लेकिन हेजिटेशन बहुत ज्यादा है. इस्लामाबाद में भी जो वाहिद केस हुआ है जिसमें हमें लगा कि यार ये वैक्सीन की वजह से शायद कुछ हो गया है, तो एक्चुअली वो नर्स को पैनिक अटैक हुआ था. यानी कि वो खुशी से लगवा भी रही थी, उसने डॉट भी किया, फॉर्म भी भरा कि मैं लगवाना चाहती हूँ. जब उसको वैक्सीन लग रही थी तो उसको इतना पैनिक होना शुरू हो गया कि पता नहीं मैं मर जाऊंगी या बचूंगी या क्या होगा. और वो आई कंप्लीटली एग्री कि शायद रेजिस्टेंस उस तरह जैसे पोलियो की है उस तरह की रेजिस्टेंस भी डेफिनेटली होगी, लेकिन जो वैसे फियर ऑफ द अननोन है, फियर ऑफ द वैक्सीन्स है, फिर जो एक काउंटर नैरेटिव चलता रहा है मार्केट में, जो होम्योपैथी ने भी बताया, होम्योपैथी ने कहा जी किसी चीज की जरूरत नहीं है. एक्सपर्ट होम्योपैथ साहब को पता है कि वो इवन हामिद मीर के चैनल पे आते रहे, हामिद मीर साहब के, और सलीम साफी साहब ने भी बुलाया, तो उन्होंने कहा जी ये सिंपल सी दवाई है, यही आप ले लें तो कुछ भी नहीं होगा. तो वो एक मेजर लेवल पे इतनी बड़ी बात हो रही थी जिससे फिर साइंटिफिक जो मेडिसिन है उसकी थोड़ी सी क्रेडिबिलिटी डाउट में चली जाती है. इसी तरह सर जो हमारे इस तरह के वाकयात कभी कभी हुए हैं जब किसी भी वैक्सीन की कोल्ड चेन को मेंटेन ना रखा जाए. मतलब एक फॉर एग्जांपल एक वैक्सीन है जिसको आपने 3 डिग्रीज 4 डिग्रीज पे रखना है, दरमियान में 1 घंटे के लिए जो वैक्सीनेटर है वो भूल गया उसको फ्रिज में रखना, या वहां से निकाल के भूल गया और वो उसकी एफिकेसी खराब हो गई और उसकी वजह से कल को कोई अनफॉर्चुनेट वाकया हो गया, तो ये भी एक बहुत बड़ा चैलेंज है. लेकिन मैंने सर जैसे अपनी प्रीवियस मोनोलॉग में भी यही कहा था कि सर ये इसका हल जो है वो एडमिनिस्ट्रेटिव नहीं है, इसका हल जो है वो शायद गवर्नमेंट के पास भी नहीं है. ये हल सोसाइटी के अंदर से ही निकलेगा जब खुद हमारे उलमा, मौलवी हजरात मसाजिद में भी कहेंगे कि ये वैक्सीन सेफ है, जब हमारे तमाम एंकर पर्सन्स, इंपॉर्टेंट इंटेलेक्चुअल्स, इंटेलिजेंसिया, सोशल मीडिया और इलेक्ट्रॉनिक मीडिया पे भी कहेंगे, इसकी फेवर में बात कर रहे होंगे, और इसी तरह फिर इसी नैरेटिव को लेके जब एडमिनिस्ट्रेशन और गवर्नमेंट चलेगी तब हमें सक्सेस मिलेगी. वरना सर आई एम क्वाइट श्योर कि अगर इस्लामाबाद के अंदर अबव 60 के लिए वैक्सीन आ भी जाती है तो 70-80% लोग जो एलिजिबल होंगे वैक्सीन के लिए वो नहीं लगवाएंगे वैक्सीन. क्यों? बिकॉज ऑफ वेरियस रीजंस जो मैंने आपको बताया कि इस वजह से उनके जहन में एक हेजिटेशन है. तो ये हमारा चैलेंज रहेगी सर. थैंक यू.
थैंक यू वेरी मच डॉक्टर नौशीन साहब. इन द लास्ट राउंड और मैं थोड़े से क्वेश्चन जो मेरे पास पोस्ट हुए हैं उनको भी बीच में इनकॉर्पोरेट कर रहा हूँ. एक तो मेरा ख्याल है बड़ी अच्छी सजेशंस हमजा साहब ने भी दी और मुशर्रफ ने भी, कि जो आपने इशारा किया था कुछ हाई लेवल डिग्निटरीज जो हैं जब वो वैक्सीन लगवा रही होंगी टू इन्फ्लुएंस रेस्ट ऑफ द सोसाइटी, तो वी शुड ट्राई टू मेक इट मोर रिप्रेजेंटेटिव, नॉट ओनली अक्रॉस पॉलिटिकल पार्टीज. लेकिन अगर मैं हमजा साहब की बात को सेकंड करूं तो परहैप्स एक दो उलमा हजरात जो है उनको भी उसी में आप साथ में बिठाइए ताकि उनके जो फॉलोअर्स फिर मुख्तलिफ मसाजिद में हैं वो इस चीज को बयान कर सकें कि वैक्सीन जो है ये सेफ है और ये लगवाना क्यों जरूरी है, ये हम सबकी सलामती इसमें है. सेकंड ऑफ कोर्स जो हमजा साहब ने अगेन जिसकी तरफ मैंने इशारा किया था कि वी कैन हैव सम सॉर्ट ऑफ अ फोरम, जैसे एनसीओसी है, कोई फॉर्मल फोरम एनसीओसी के अंडर बन सके, डिफरेंट डिस्ट्रिक्ट एडमिनिस्ट्रेटर्स का, डिप्टी कमिश्नर्स का, या एटलीस्ट एट कमिश्नर लेवल, सो दैट दे कैन शेयर their experiences with each other, sort of note taking. And third जो मैंने इशारा किया था, that was about जो एक hesitation or stigma and taboo attached with vaccine in Pakistan in general. So polio vaccination, we know that polio vaccination, why we are not able to complete and achieve eradication of polio from Pakistan due to this very strong resistance from a certain segment of society. So don't you think that that segment would keep on posing resistance on COVID vaccine, or you think that it is a completely different thing and the segment opposing polio vaccine, those would be neutral when it comes to COVID vaccine? Over to you.
Yes, definitely there are many myths around this vaccine, and obviously there's a propaganda also, and it's not only in our country that we are a middle income country or developing country. You can see this type of resistance even in the developed nations. If you look at the figures, even in Canada, in USA, and in European countries also, the governments are also facing the same problem over there also. But in our country, because of lack of literacy, it will be more difficult to reach to the people, because many people do not understand the necessity and dynamics of vaccination. They are not convinced that this corona is harmful for the country, for the population, or it can go on and stop the normal life. So people do not really, because I have met many people, especially in the rural areas, they don't think that corona is something to be being bothered about. So it will take some time to get these things down into the population, to make them understand. And I think it will require a big awareness campaign, and by the time we go to these rural areas and convince those people, because we are facing this resistance in the cities also, and in the big cities, as was just mentioned, in Islamabad also, in Lahore, in the cities which we feel that there's more literacy rate. So it will be a great difficulty in the rural areas also. So, but basically, I think as it's discussed in many forums also, okay, this is a livable virus. We have to learn to live with it, because it's not going to go away in 2 months, 3 months, 4 months, and we cannot stop the life for an unlimited period of time. So lifestyle has to change. The social norms have to change. The handshaking, embracing each other, all these things have to be limited. Then decreasing the number of guests in the social gatherings. Like I also agree with you that physical distancing is more appropriate to be followed. That we cannot stop the life altogether, but we can reduce the number of interactions, and we can reduce the number of people in a specific area at a specific time. So these things need to be taken care of. And then there's a good suggestion that some ulama also need to be vaccinated. That will give, I think, a very good message, because most of the population in our country, they do follow this Imam Masjid and the ulamas. So that is a very good suggestion, and I will definitely put this forward. And also about the forum of administration, which you just mentioned, that is also because we need to share our experiences. We need to share the good practices and the success stories which we are getting in some areas and not in the others. So and overall, what I think is that strengthening public health and health system capacity to be increased, all these things in the coming days, we have to look into these. We have to train our healthcare professionals for these pandemics, because what I see and what I believe and what people are talking about, that this may not be the first or the last pandemic for in our lifetime. We may see other viruses also coming up. So we have to, overall, we have to look into our healthcare systems and the correct training of the healthcare professionals, because when this pandemic came, even our healthcare professionals were not aware how to use the protective equipment. So I think many changes have to come in our system, in our healthcare systems. And telemedicine, I would like to mention this also. Okay, this is also a new platform, and I think gradually this is making its place in the society, and many people are using this platform also. So we have to use different ways and modify our lifestyles so that minimum interaction occurs between the people, and at the same time life goes on. Thank you.
Thank you. Hamza Sahab, if I can come to you in this final round, and then I'll go to Mosharraf for last words. There are a couple of questions, and so I can see that there's in my chat box, district administration Islamabad, Twitter is much appreciated with regard to Islamabad's daily update on COVID-19. Other districts should also follow this model. Please also share a comparative graph for the past 1 year since the pandemic started in Islamabad. Thank you. The question that they asked is about the marquees. Although the indoor function would, wedding function would start from 15th of March, but we can already see it happening in E11 marquees. So indoor E11 marquees, does it get categorized as function outside, or is it still inside indoor function? and any particular SOPs that you would be having for children and elderly people. So these were the three questions posted for you, and then I'll come to Mosharraf.
Sir, thank you very much, sir. I'll share the 1 year's graph of COVID rise and fall in Islamabad. And I think it's an excellent suggestion that all other deputy commissioners should also come on social media and share the progress or the work that they've done or the results that they have shown in the last 7-8 months, so that will increase their credibility in the public as well. As regards to the second question, sir, indoor weddings are not allowed. Only indoor wedding is allowed in a certain marquee where there is at least 300 feet of 300 feet of area through which there is an exhaust going on. For example, E11 के अंदर ये Aura Grand और इस तरह की 3-4 marquees हैं, they have removed their side panels and they've installed huge exhaust fans inside their marquees. So those are allowed. Otherwise, जो enclosed marquees हैं उनके अंदर allowed नहीं है. Tonight I will also go and inspect if there is any evaluation going on in any marquee. And as regards to the third point, sir, जो schools और elderly बच्चों की और elderly की आपने पूछी है, सर इस्लामाबाद के अंदर जो हमारा डेथ रेट रहा है 1% रहा है पॉजिटिव केसेस के अंदर, और उसमें से भी लेस देन 30 में जो डेथ रेट रहा है वो सिर्फ एक बंदा ऐसा है, there was only one person whose age was less than 30 and he died and he had no other comorbidity. Otherwise, there is not a single case. So we are not, as far as I am concerned, in my priority list, youth are not, considered कि वो उनको बहुत ज़्यादा हो सकता है. उनका सिर्फ ये इशू है कि स्कूल के बच्चों के थ्रू उनके पेरेंट्स को जब पहुंचेगा तो वो उनको हो सकता है. उसके लिए फिर वही हमारी SOPs है जो स्कूल के अंदर हमने इन्फोर्स की हुई है कि इस्लामाबाद के अंदर जिन स्कूल्स के अंदर फिजिकल डिस्टेंसिंग कर सकते हैं, वो बच्चों को स्ट्रैगर कर सकते हैं, तो वो तो स्कूल्स में 100% अटेंडेंस रख सकते हैं. और जहाँ पे जगह नहीं है, जहाँ पे स्कूल की पॉपुलेशन बहुत बड़ी है और जगह टाइट है, तो वहां पर अभी भी SOPs रहेंगी कि वो कोशिश करें कि या ऑल्टरनेट डेज पे बच्चों को बुला लें या टाइमिंग चेंज करें या फिर उनको ऑनलाइन के ऊपर शिफ्ट करें. एक ही SOP होगी. और बाकी सर जो जनरल SOPs हैं ओल्ड के लिए और बच्चों के लिए वो वही है जो फिलहाल तो जो गवर्नमेंट नोटिफाई की हुई है कि मास्क पहनना है, हाथ धोते रहना है, दूर रहना है, फासले में रहने से. थैंक यू.
Thank you, Hamza sir. Mosharraf, towards end, I'll come to you. I know Dr. Nousheen Saba, she is still on line. Two things that I would like you to quickly comment upon. One, the role of civil society, non-governmental organizations like yourself and SDPI, how we can strengthen hand of district government, district administration, as well as government in this pursuit to making everyone safe. No one is safe until all of us are safe. And the second, you and I both, we are COVID survivors. And one thing that we were discussing the other day, that there's a lot of work going on clinical side of treating COVID, but we can't see much on emotional and psychological side of combating this disease. So your quick comment on this, and then I'll come to Dr. Nousheen for her closing remarks.
Thank you, Dr. Suleri. I think it's a good question. The question of what is the role of people who are not in government, but who have an important responsibility in terms of the public discourse, helping inform the public discourse and helping to challenge those that are in power. Not so much because there's anything wrong with the people in power, but simply to maintain and sustain the kind of pressure that will generate better public policy. So I think that, for example, again, just as an example, a lot of Pakistani government officials are insisting that, the vaccine resistance or anti-vaxxer sentiment is not innate to Pakistan. And that's absolutely 100% true. In fact, a lot of the propaganda that has been manufactured against the vaccine has been manufactured in the West. It's been manufactured by right-wingers in the United States and in the UK and in other advanced countries that otherwise are supposedly much more advanced and much better at handling scientific challenges than a country like Pakistan. That being true doesn't mean that those countries are in any way in the same place as Pakistan in terms of the vaccination campaign performance. And that has a lot to do with resources. And I mean, obviously, again, we're in Pakistan and we're conscious. For example, I'm conscious of the resources that somebody like even Hamza Shafqaat in Islamabad as a DC, the limitations that limited resource put on our district administrators and on our chief executives, whether it's chief ministers or prime ministers, certainly other kinds of ministers at both the provincial and federal levels. But, you know, the United States has vaccinated almost 75 million people. Pakistan, I think by Friday, the count was less than 75,000 for the 500,000 CanSino shots that are available. Only 72,000 and some had been used. Now, there's a, you know, it's one thing that for there to be anti-vax sentiment that is common, another thing for Pakistan, for example, to be one of the last remaining countries that still has cases of polio. And again, I would say that the purpose of that point is not to beat up on ourselves or to be self-critical. The purpose is that the people that are getting polio and the people that will die from COVID-19, where those deaths or those diseases are avoidable, we must explore and try to understand what it is about the system that we have in this country, despite having the kind of talent that you know, the Islamabad Capital Territory has at its disposal, despite having the kind of talent that, for example, SDPI has at its disposal, and despite the kind of upstanding and really phenomenal representatives that are like Dr. Nousheen. Why is it that with all this talent and all this integrity and all these brilliant, innovative people, polio is still happening? And where there are avoidable cases of COVID, where we've been lucky from a maybe from a physiological perspective, maybe from an environmental perspective, maybe from a, you know, MMR, other kinds of factors that helped Pakistan really deal with the COVID-19 vaccine much better than many of us expected that it would. Despite that, we should be upset when there's an avoidable death that ends up being a death. And that upsetness is not as a criticism of the DMG or the Pakistan Administrative Service. It's not a criticism of the PTI. It's not a criticism of our religious leaders. And it's not even a criticism of our nonprofits or our think tanks or research advisory firms like the one that I work for. It's really a challenge for all of us to think about what systemic changes are required for us to be better at getting the things that people need to the people that need them in a time frame that works. I think the strategy of allowing the private sector to bring vaccinations into Pakistan is absolutely brilliant. It exactly addresses an existing class divide in this country, where we know that साफ पानी के लिए नस्ले हो जाएगा, अच्छी स्कूलिंग के लिए प्राइवेट स्कूल हो जाएगा, अच्छी हॉस्पिटलाइजेशन के लिए बहुत नहीं हुआ तो पाकिस्तान से बाहर जो है चले जाएंगे. You know, we've privatized the service delivery at a very massive level in Pakistan, so that even middle and lower middle class folks are engaged with private sector where they should be served by the public sector. Now, we also know that not every Pakistani will be able to do that. And so our demands or our expectations of our own country should be that starting at the least capable, least privileged, and most vulnerable, and then building all the way to the top. Nobody's expecting ke, you know, yahan pe excess hoga vaccinations ka. But we are expecting some humility and some reflection in terms of what the strategy will be on crisis communications. Because tomorrow, the pressure will be on Hamza Shafqaat. And the pressure will also, unfortunately, be on the politicians. Before we get to that stage, if there's a second or third or fourth or fifth wave or resurgence of the virus, isn't it important that we actually start investing in a push right now so that we maximize the number of vaccinations that we can? So my appeal or my challenge to myself and to you, Dr. Suleri, and to our friends in other nonprofits, other consulting firms, other places where those of us that think for a living and write for a living, one is to be humble. So I remember distinctly, and I've said this publicly many times, I was wrong on the original first wave and second wave, and the Prime Minister and the NCOC and the government of Pakistan were right. and being right probably helped save lives, but definitely helped save livelihoods. The SARS Emergency Cash Program was a brilliant, initiative. But it's now important, not as a criticism of Dr. Nishtar, but as a Pakistani, to ask, okay, where's the next 12,000 rupee payment coming from? When is it getting paid? Should that have been the next payment instead of the interest-free loan program, which is drawing controversy? This is all part of the wider conversation we need to have as a result of COVID-19, in which our criticism is designed to elicit better outcomes for more people in our country.
Thank you, Mosharraf. Very last comment from Dr. Nousheen, and then we'll conclude. We wanted to keep it under 60 minutes, and I can see we are in the 60th minute. Dr. Sahab, आपकी तरफ से कोई?
जी, बस it's a very short comment. I think we have gone a long way since 26th February 2020. We have built our capacity in many avenues, especially the healthcare system, in providing the oxygen beds, in the ventilators, the testing capacity increasing from 1 lab to 150 labs. So there are many things yet to be done. But I think we are moving somewhere, and being a middle income company, still Pakistan has gone a long way. But with the advice of people like you, with suggestions and recommendations from all these worthy speakers, I think we will move forward, and inshallah ta'ala, Pakistan will see good days soon, inshallah. Thank you.
Thank you. We'll continue this series. Thank you very much, Hamza Shafqaat Sahab. Thank you very much, Mosharraf Zaidi Sahab. And thank you very much, Dr. Nousheen Hamid. I learned a lot from this discussion, and will definitely put forward all the recommendations coming out of this forum to Dr. Nousheen Sahaba's office and to other relevant authorities. See you next week, inshallah, with the same topic with some new guest. Khuda Hafiz.